With me this week is a very special friend of mine and colleague, Dr. Natalia Santos. How are you, Natalia?
Doing well, Dr. Christman. How are you?
Good. I missed you so much. Those of you that are tuning in, Natalia we used to work together at Bricktown Veterinarian Hospital.
That's right.
And,
you're very important to me.
I know, I miss you so much. And what I want people to understand today is, share a little bit about your experience because you're a new graduate. Congratulations. I guess we can't say that anymore because it's going to be a 1 year. It's coming up on your 1 year work anniversary. So
that's right. In June, I was hired.
Yes. So share with me a little bit of how that's been in terms of the transition of going from school right into practice.
Yeah, so I elected, I guess, a month and a half to get situated back from Indiana, emotionally and physically, getting all my stuff in the car, taking the 13-hour drive back here, back to practice. So really, brushed up on those AVMA guidelines on vaccinations, reading the ACVIM guidelines on how to manage PLN. I was just engulfing in all this stuff, wanted to be practice ready. But I'm really blessed that Bricktown Veterinary Hospital, you and Dr. Brongo being my chiefs of staff at the time, kind of weaning me in, giving me hour appointments, literally being by my side, asking me, how I'm feeling, checking in, and then shaving that time to get me really, at the half hour to 20 minute appointments, which is what we would consider, normal at our practice. And then with COVID, really we're seeing double the amount of clients usually. So that has been challenging, and that definitely telling me to hone in on my communication skills. We're definitely on the phone more with our clients. And I guess it's difficult because, as veterinarians, you and I and everyone else who practices, we're very big on body language. So I kind of read my clients' body language as well. And it's difficult when I'm telling them good news, bad news. I'm like, I can't read what direction, how aggressive or, conservative we want to be today. So it's difficult to gauge all that over the phone. And especially giving bad news during this time. I'm very touchy-feely. I put my hand on their back when, I'm euthanizing, a patient, or, I give them a high five if we finally got a hold of that otitis externa, that we've been battling for a couple of weeks. So it's difficult in that respect too, that I'm not able to be, as personable in that respect. We have to stay safe and keep everyone safe. But it has been frustrating as well in that respect for our client, for our team members too. Our nurses are working 5 times harder. I'm surprised you don't want to kill me yet. But, I'm really thankful for, we definitely have to have a strong team to make this work. And we do have that, at least at our practice we do. So definitely proud of, of them and bragging about what we do. And our clients, for the most part, are understandable. I think I don't hesitate to remind them that, we are humans sometimes, and I think they need that. And they're like, okay, that's right. I won't hesitate saying like, I'm eating my lunch. I hope you don't mind that I'm going over this blood work with you. And they're like, oh no, I understand. So I think that helps as well, giving them the reminder that we're going through it too.
Right. Yeah, absolutely. You're essential and you're human, just like anybody else is too. And your day has so many roller coasters throughout it, highs and lows, new puppies, and then end of life care like you're talking about. So it makes it tough. Getting back to your new graduate experience. So how has it overall been up to COVID? And then how has that kind of changed the way in which you perceive veterinary medicine during COVID?
Yeah. Up to COVID, I felt somewhat comfortable. I'd say not complacent. I think that's too comfortable, but definitely knew how to, go with the vaccination schedules, definitely more comfortable with that. Like I said, skin, teeth. And then with COVID, it's difficult. Sometimes haven't hesitated, like taking pictures of x-rays instead of taking them in the darkroom and pointing out, lesions and things of that nature. And, it's just definitely been more difficult in that respect emotionally as well. It's definitely, I think we have some imposter syndrome that I kind of shook it away for a couple of months. And then it came back, when this all started. I'm like, oh man, how am I going to be able to effectively communicate during these challenges? Definitely in the beginning, like in March, I think middle of March, right? That's when this all kind of went down. Yeah. I had to really think on my off days and how I can be, as effective. And that's, I think we all try to make sure that everyone understands in the room what's going on. So
I like what you said before too about body language, especially in veterinary medicine. Those of you guys that don't know, body language is extremely crucial to how we effectively communicate our treatment plans to our pet parents. And Dr. Santos has brought up a good point with COVID is you're talking to them over the phone and you don't know what they're going to want to do. There's so many options that we have to provide these pet owners with, and it's hard to read them.
Yeah, absolutely. Yeah. So, and sometimes I like, I even get more history. I ask more. My nurses do a great job getting history. They pretty much understand the questions I ask, but sometimes I ask more detailed questions, and if they're like, oh man, I forgot to ask that, I'm like, it's okay, I'll call them and ask them. So that's just another way of, I guess we were talking about efficiency before, that I'll forget to ask that because I have so many other things juggling in my mind. Oh, they're overdue for a heartworm test. We can do that while they're here. And, we can booster that leptospirosis vaccine today if, the ear infection isn't so bad. So I'm just like juggling so many things, and we forget things sometimes, but, overall, the body language, both pet and client, are extremely important in our field.
Yeah, absolutely. And what are some pieces of advice that you would have for the new graduates? We have a graduating class that's coming out.
Yay!
And congratulations to the class of 2020.
So proud of you all.
Right. And so here she is, everybody, Dr. Santos, that has been there for a year. And what is one thing that you are glad you took back, that you did? And then what's one thing I said, oh, I wish I told the older Natalia a year ago, blah, blah, blah.
Oh, that's good. Yeah. And I will definitely shout out to my alma mater at Purdue for making us so, I guess, so financially literate, and like understanding that at the first semester, like you are either going to make a lot of money one day or you're going to be managing people that make a lot of money. So understanding that, not being afraid to negotiate, asking questions when you're through your contract negotiations, understanding your benefits, knowing what a 401k is. So not so much in practice, but I think getting ready to practice, I think that's just as important. And then one thing I wish I knew, I guess, and this is just the theme for me personally, just not being so hard on yourself in the beginning. I remember freaking out, not knowing, like, the mgs per kg for clindamycin range and like, Rimadyl and all this stuff. And I would have to like, feverishly go through my notes and find all these things. And I think either you may have put, a hand on my shoulder and be like, it's okay, it's going to come to you, don't freak out. But it does come with practice. And that's why we say practice. So just understanding that, and, really even 1 year in, I have a long way to go, and I'm still going to be learning every single day, which is what I love and what probably you love about this profession. Yes. So I think just being nice to yourself, is really being nicer to yourself rather is really invaluable, and just remembering to take care of yourself.
Yes, I love that. Taking care of yourself is so crucial. It really is. And don't be hard on yourself. I think it's nice that you do surround yourself with a good network of veterinarians and colleagues that can help support you and elevate you and coach you along for the ride. And it's, practicing is just exactly what you said. It's practicing, and it's an art, and it's something that can consistently evolve, and there's no perfection, but you can do the best you can. And that's what's great about this career too, right? Yes.
I think at the end of the day, I'm like, did I do the best I can in the situation I was in? And the answer is always yes. So I can sleep at night. But, I think that's important, to just be nice to yourself, Be
nice to yourself, I got to give you a special shout out for you, because your communication style is incredible. And that comes from training. And I could tell Purdue does do a very good job. And this is something that I know that they work really well on effective client communication. And I've learned so much from you when I was practicing with you on how you answer the
Aw.
phone calls. And yeah, you have a very good communication skill set that, of course, we all can work better on it, but you have a great solid foundation. So, bravo to you on that.
Thank you. Yes, again, shout out to my alma mater. Very, very blessed that I went there.
Yes.
Yes.
So what's some advice that you would have for self-care for the new graduates? What are some things that you would recommend for them to make sure they take care of themselves?
Yeah. For me, it's food. I don't work well if I don't operate well, if I don't have, my breakfast, my lunch, my dinner, my tea, my ice cream when I get home. So you got to find that's what's out for you. I would argue for you, it's the gym, working out. That's definitely your outlet. For some people, it's both, bless them, that they could do both, but really just finding your outlet. And it's so typical. Coloring. I have friends who make music. I have friends who go to church, like just finding that. And really sticking it and honing on to that, and really sharing it gives you a lot of joy as well. I love cooking for my family. If I could, I bring it to work, but we can't right now. So I think that's really good self-love, self-care. And then, I love affirmations. I've been using them, I think, before I knew what an affirmation was for years now. I'm very big on putting Post-its on the wall and saying my goals, both short-term, specific, long-term. I think that's great as well, to really just keep you focused both, with veterinary medicine and not with veterinary medicine. I think I'm still trying to figure out, that balance. It's definitely not perfect. We were just saying how I work from home, even with this, even I'm not in the office. So just, learning how to change with that as well.
Right. Yeah. Learning to adapt and deal with change. Veterinarians are very good with that, but this pandemic has put such a damper on how well we can adapt and cope with these things. And you did talk about the life skill set too, like a vision board. And I think that's wonderful. And I do recommend that to anybody, but specifically the veterinary graduate, because they get so honed in on practice, but then they tend to forget about their other things, about maybe I want to start a family, or, maybe I want to take up some of those hobbies that I'm, because you've been studying so hard and taking those boards that you forgot, I'd like to go horseback riding, or I'd like to go to the beach, right?
Absolutely. And one other thing I'll add too that helps with balance, and I'm sure, many of the new graduates here have this, whether it's WhatsApp or GroupMe that you had with your clinics, with your block mates. I still have that, with my really good friends from school from, semester one. And we vent to each other. We're sending pictures. We're like, what the heck is this? Have you done this? I don't know how to manage this. Hang in there. We're all going through this, friends in Chicago, California, New Jersey, Michigan. It's crazy. And it really does bring us all together, that we're all able to be like, okay, this is a crazy time, but it gives us some comfort that as a community, we're all going through it together and figuring out it together. And it looks different for every single practice, but it helps, it's like a virtual hug.
That's as virtual as a hug as it's going to be, I guess, for a while.
Yeah.
But it's nice to surround yourself with people like that to vent, to cry, lean on, because we need it in this profession.
Absolutely.
Yes. Well, Dr. Natalia Santos, thank you so much for your time. I am over the moon proud of you. And I want everybody to know, this is the power of a mentorship right here, because I've known Natalia for a few years now, and I've watched her grow and develop from a veterinary student to an incredible colleague and a friend. And, this is what our profession's all about, is giving back and coaching and leading the next generation of veterinarians. And this girl right here, if I can point to her, she is going places. So be on the lookout for this one.
Oh, goodness. I'm so lucky to have you.
Oh, thank you so much. I miss you so much. And thank you for being on.
Of course. Mwah.
Love you. Mwah. And everybody out there, thank you so much for tuning in. And we will see you guys next week. Stay safe and take care of your fur babies as well. Walk them.
Yes.
Bye, guys.
Bye.